Yeah. Well, I always believe that when it comes to health, prevention is better than cure. I mean, most healthcare systems are based on when you're sick, you come into the hospital. And I always think, well, why aren't we tackling why people are before people are sick? So a lot of the diseases that overwhelm a lot of African hospitals sometimes they're curable. So if you look at things, even cancer, like basic cancer diagnosis, screening, stuff like that, and look at if you look at things like TB, before the COVID pandemic, TB was the number one killer in the world. It kills one person, I think, every 4 seconds. Well, so roughly 1.4 million people a year die from TB.
Really?
Um, yes, and that's across. That's not just in Africa, of course. It's in Asia as well. And I always say this as an anecdote, and I always say officially for a reason. So officially, if you look at the statistics during the pandemic, um, the more people were dying in India and China from TB than COVID.
Okay.
Officially, and I'm saying officially for a reason.
Yeah.
And that shows you that that's a bigger problem. That was a bigger problem during the pandemic for them than COVID. Because TB is highly contagious. If I had TB and I was in a room and I coughed, everybody in that room will get TB. So, going back to your point, if I had 100 million, what I would try and do is invest in technologies that bring down um, the the time for diagnosing people. Because when people get diagnosed later, that's when it becomes fatal and becomes overwhelming for health systems. Um, so one of my first papers when I was working at the think tank in Saudi was actually the need for a TB vaccine.